Greeting Dr. Kiza. This is ssemwogerere John Paul doing public coursework handling the part of welfare programs. Then when we go to welfare programs, part is welfare programs, targeting and incentives. Therefore, when we are looking at welfare programs, we can say that these are basically, in simple terms, we can say that these are basically government programs that are aimed at improving the people's welfare. So in definition, we can say that welfare programs are federal government sponsored assistance for families and individuals in need. They are social programs designed to provide financial assistance as well as access to food, healthcare, and other basic needs. Then we can say that in Uganda, several welfare programs have been set up. And that in simple terms, we can also say that welfare programs are basically aimed at providing basic needs to the poor families or providing basic needs to the poor families and then also to the people in need. And in Uganda, we have seen different programs have been set up to improve the people's welfare. For example, we have Emyoga, we have Fenatugagawale, we have Entandikwa, Operation Wealth Creation, and of recent we have seen the parish development model that has been set up of current. Welfare programs are a bit related to sustainable development, meaning that welfare programs aim at improving the people's standards of living. And then also we look at sustainable development aiming at improving the people's standards of living both in the current situation and also for the future. So in simple terms, you can say that welfare programs are somehow related to sustainable development because they all aim at improving the people's status both in the current situation and in the future. Because welfare programs, for example, when you look at these welfare programs, they improve on people's standards of living in the current situation and then also in the future. Examples of there are different examples of welfare programs that have been set up by the different governments and societies in order to improve on the members of the society. For example, we have Medicaid. Then when you look at Medicaid, it's like some welfare program that for it aims at providing medical care to the individuals, basically to the low income earners, because we say that welfare programs basically look at the low income earners. So Medicaid is basically given to individuals of low income earners and it is in the bit of healthcare. And then for someone to be eligible to attain this to be eligible to benefit from this program, a person must either be having a disability or must be an adult of over 60 years. So in simple terms, we can say that for someone to qualify for Medicaid, a person must have disabilities and then also must be beyond the age of 65 years. That is the first one. And then another one, we have supplementary nutrition assistance. Nutrition assistance. For this one, supplementary nutrition assistance, as we hear the term nutrition, it basically looks at people's feeding. So we can say that supplementary nutrition assistance, it deals with food assistance to the poor individuals, and then also to the poor individuals, and then also to the families that need. And then also this assistance can also be given to individuals that have faced certain challenges. For example, it can also be given to individuals that have faced challenges, for example, floods, famine, drought, and so on and so forth. The main issue of nutrition assistance programs or food stamps is basically to improve on the people's nutrition, because food is one of the basic needs that is needed for individuals to be stable. So in order for individuals to live a better life, one of the major basic needs beyond even the others is food, because food is needed for an individual to live a better life. Because if someone's nutrition isn't good, then that means all the other things are going to be bad, or someone won't live a good life. That is the second one. And then another program, we have Head Start or hands-on. For this program, of recent, it has been of increasing rate, for example, in Uganda, whereby we see that the government of Uganda has tried to set up various programs basically to provide the youth with the different skills that are needed for them to start up their own jobs. For example, for the Head Start or hands-on programs, we have the government has provided catering programs, the government has provided fashion and design program, carpentry. All these are aimed at enabling the youth or the poor basically to have or to live better standards of living, because when someone is equipped with the skills, he or she can be able to set up his own program. And for this hands-on program, it's a bit different from the current education status, because for it basically deals with the skills rather than being more of a theoretical than practical, because for it it's more of practical, because a person does something that he or she learns. And therefore, if a person is equipped with the skills, he or she can be able to implement the skills that he has learned. And then another one, we have housing assistance. For housing assistance, the government usually provides assistance to different individuals that are in need. In Uganda, this housing assistance has been generally through the Housing Finance Bank, whereby we have seen that the Housing Finance Bank provides assistance to individuals who want to set up or who want to have better houses but do not have enough money to build their own houses, like using the fixed incomes that they have. And therefore, the government through the Housing Finance Bank was able to provide certain incentives or certain allowances that through this bank individuals can be able to build the houses but paying in installments. Therefore, this housing assistance, it looks, or it basically its main target is for the low income earners that cannot build houses of their choices, but cannot build the houses of their choices using the fixed incomes that they can. Therefore, the government in Uganda through the Housing Finance Bank, although of recent it has also extended to other different banks whereby individuals can be built houses and then they pay in installments. Then also of recent it has been through the housing assistance in Uganda, it has also been visible through it has also been visible whereby the government tried to collect some iron sheets to cater for the people of Karamoja, though this assistance never reached the target group because the iron sheets were embezzled on the way before they reached the final stage of Karamoja people. And then another one, we have supplementary secondary income. Supplementary secondary income is another program. Through this program, we can see that the government tries to provide income to the individuals that are in need of financial assistance. And via this program, supplementary secondary income, we can see that it's generally given to individuals with disabilities, elderly, and for someone to be eligible for such assistance, an individual should be a citizen by birth. And then of Uganda, we have seen that such assistance has been given to elderly people in Uganda over the ages of 65 years. And usually the income that is given to these people is usually 20,000 per individual per month, though the program was initiated but it hasn't been put into further positive action because of one way or the other, or depending on the programs that the government is running, or depending on the financial assistance of the program of the country. That was basically for the housing assistance program. And then lastly, on my last slide, I have the target groups for welfare programs. And then before we look at the target groups, we can see that for anyone to qualify for these welfare programs, one, someone has to be a citizen by birth. That is one. And then also, someone must qualify for the given things or for the given conditions that certain communities set up for anyone to qualify. For example, someone for given communities, they might look at the income status, might look at the health status, and then also and so on and so forth. And then for these welfare programs mainly aim at, in simple terms, they basically aim at low-income earners and the disadvantaged peoples in the society. And uh, it can be attained through loans, grants, donations, food stamps, medical care, housing assistance, and so on and so forth. And then examples of the target groups for these welfare programs, we have the low income earners and families. Well, generally, we say that all these welfare programs aim at the low income earners in the community, but welfare low income earners are among the target groups, and usually for anyone to be for low income earners, we can say that different communities say that, because when you look at low income earners, we can refer them to as people facing poverty, and for anyone to qualify to be a low income earner, meaning that a community has to set up that within a given community or within a given country, if anyone earns below a given amount, he or she qualifies to be a low income earner. So these welfare programs can be given to anyone of a given community who qualifies or who receives a given amount that is specified by a given community, that if you receive below it, then you qualify to benefit from these welfare programs. For example, like generally in at the world status, we can say that for someone to be referred to as poor, he or she must be living below $1 per day. And therefore, if we base on that as our general assumption, we can say that most of the people in Africa qualify to be low income earners, meaning that they mostly qualify to benefit from these welfare programs. And such programs enjoyed by these low-income earners, we can have like education, healthcare, clean water, among others. Then another one, we have elderly people. Elderly people, initially we talked of in the welfare programs, we looked at Medicaid, and then usually we know that these elderly people face certain challenges, because to a certain point you can find elders that for them, when they are no longer working, they have no one to take care of them. They cannot provide for themselves the basic needs that are needed, and therefore the government has to come in to provide for these individuals. And basically, the people that we look at as elderly among the welfare programs, we look at people that are beyond 65 years. And the main issue of medical care to these elderly people is to at least try to increase on their life expectancy. Though in most developing countries, the life expectancy of people is 65 years, that is maximum. But there are those that tend to go beyond it, and therefore we need to take care of these people so that we see that they can at least, since they have gone beyond the maximum age, but they can also tend to live a better life, because we see that some individuals that are beyond 65 years, they are still of more importance to the community, because generally if you look at most of the big managers and company owners, most of them are beyond 65 years. Therefore, if they are still of more value to the society, then that means they still need to be taken care of by the government and states to simply see that their life their life continues to improve. And then another target group, we have the unemployed individuals. Then when we talk of the unemployed individuals, this is a general problem to most of the developing countries, because when you look at most of the developing countries, the unemployed individuals are basically the youth, because we see that the rate of population growth and job creation, the rate of population growth is higher compared to the rate of job creation. And therefore, the governments have to come in to see that, yes, fine, the population is growing. And then we know that one of the indicators of economic growth, we have population growth. But yes, fine, it is a good indicator of economic growth, but is population growth increasing with the rate of job creation? And then if not, then that means the government has to come in to provide certain incentives or programs to these individuals that are not employed, to see that they can also be able to attain their basic needs, because we see that individuals that are poor cannot be able to attain the basic needs that they do want, because if an individual is unemployed, then he or she will not have access to money, and if someone has no access to money, then that means he won't be able to attain the basic needs that he or she wants. And some of these unemployed individuals can also be helped by the different governments of their states to create like jobs. For example, for someone to create a job, it can be attained through job training such as Head Start education, among others. But all these programs must be aimed at enabling these individuals to help them to start up their own programs or their different jobs. Unlike in Uganda, we have seen that the government has started up piggery farms, poultry farms, carpentry, all aiming at providing employment opportunities to these individuals. But yes, fine, it aims at providing employment opportunities, but main aim is to enable them earn a living. Then another target group, we have the children. Children is another target group. And for the children, we see that most of the children die before birth. And then when you see children, for someone to qualify to be a child, it basically depends on the, for someone to qualify to be a child, basically depends on what a given state has done for someone to be a child. And for example, in Uganda, for anyone to be below the age of 18 years, one qualifies to be called a child. And therefore, one of the basic needs of children, we can see one of the basic needs that children do need is we can see education, we have food, we have shelter, healthcare, among others. And therefore, governments of different societies or communities can tend to provide all these, in simple terms, basic needs to these children. But all these must be aimed at all these must be given to the children that are from families or family backgrounds that are facing financial difficulties. Therefore, for the target groups, we have low income earners, we have elderly individuals, we have unemployed individuals, and then children. And then the last bit, we have welfare incentives. Then we can see that incentives are rewards offered to individuals to motivate them to make a certain action and achieve certain goals. Meaning that welfare incentive, it's like as if you're giving someone something to enable him attain a certain thing or to be able to achieve a certain goal in life. Because usually, for example, when we go to industrialization, some of the incentives we can see like reduced taxation, all these are aimed at enabling certain individuals to attain something. And then some of the incentives in welfare, we have work incentives. Among the work incentives, these, because all these are under welfare program and all the welfare programs are provided by the government. So when you look at work incentives, these ones basically these ones are basically provided by the government, and the government can provide job training or education to help individuals acquire certain skills that will enable them earn certain money. Then when we look at work incentives, we see that the government gives the individuals jobs. We can see that the government, one of the ways of reducing on the level of unemployment, we can see that the government can try to create certain projects, but these projects are not basically profitable, but they are aimed at enabling people to have jobs. All these projects are aimed at providing employment to individuals that are unemployed. That is for work incentive. Then we have education incentives. Education incentive. We look at apparently for anyone to live a better life in the current world, someone must have papers to qualify for any position or to qualify for any job, because even currently, even to go abroad, someone must have some certain education qualifications. And therefore, the government, for example, when you look at the government of Uganda, it has provided some education incentives to families that are from poor backgrounds. For example, we can see that it has offered scholarships in colleges, universities, vocational studies, and also it has set up some schools or it has also set up a universal education both at primary and secondary level. But the main issue is to motivate students to attain or to achieve that desired goal of being educated. And then we also have health incentives. Health incentives. Everyone, for health incentives, everyone desires to live a better life that is free from diseases and free from health complications. And therefore, when you look at health incentives, we can say that governments can provide some cheap health facilities, free medical care through different means, or even this healthcare can be provided through certain NGOs, for example, the Red Cross, and so on and so forth. And then lastly, we have financial incentives. For financial incentives, it's somehow same as financial assistance, because we see that some individuals might want to start up some businesses, but they do not have access to funds. They don't have access to funds, and therefore they don't have access to funds, or the funds that they have cannot enable them to start up that business. And therefore, the governments have to come in to try and see that, yes, fine, if one wants to start up a certain business, let me say like of 1 million, but a person has capital of around 600,000. So the government has to come in to see that maybe it can help the person with the remaining balance of the 400, and then maybe also the person will be able to pay certain interest after a given period of time. That is for financial assistance. But in general, to summarize welfare programs, targets, and then incentives, we can say that in conclusion, welfare programs are aimed at improving the people's standards of living, both in the current situation and for the future. And welfare programs, we can say that they basically target individuals that are of low income, or are from poor family backgrounds that cannot be able to provide themselves with the basic needs that are required for one to live a better life. Thank you very much. I remain Ssemwogerere John Paul, doing BA Year 3.